what I want to do today is to take stock of the COVID situation as I've seen it evolve, take stock of some of the global movements that I've also witnessed, but I do want to use this moment to think hard about how we are collectively learning from COVID, and indeed what we are applying in the way of our learning as other challenges are being addressed. And the we word that I'm using relates to people who are in positions of authority in public health. I put myself in that place, and who are using those positions of authority to try to get better results. In that regard, I'm extremely pleased that John Atkinson of our team is here. I saw him just now, I've lost him. Anyway, there's John. And I hope, John, that we can, at suitable moments, have a bit of a discussion about the manner of learning and the way in which that's being applied. I've had a number of events, including at the UN General Assembly last week, where I was quite often put on the spot by people saying, well, what have we learned as a world? And I thought that might be of interest. And I do want to focus on the food, energy and finance crisis, what we're calling the poly crisis, and the work of the UN Secretary General's Global Crisis Response Group. I know that's of interest to many of you, and it's been something that's been very high on my own agenda. I want to apply the usual practice of offering a conversation for a bit, and then I will stop and open up for discussion. But if anybody has a thing they want to say at any time, and you can do so, please use the raise hand function on the reaction button on the bottom of your screen, and then I will stop. And hello to Marianne Hasselgrave, I've just seen you on my screen, lovely to see you there. And Tessie, thank you for turning on your camera. In fact, everybody who can turn on their camera, please do so. It changes the nature of the interaction for all of us. Now, let's just spend a moment on COVID. Of course, this virus is still very much around, and actually we cannot trust the incidence figures that are put around in the WHO outbreak curves, because quite frankly, most people who are getting COVID these days are either not being tested, or if they are being tested, their test results are not being reported to any authority. The WHO is very clear on this. There's just no way of telling whether or not we've got new surges coming. But it is my view, and I think the view of many of the colleagues that I am talking to in WHO, that there will be another surge picking up during October, and that's likely to be combined with a surge in cases of influenza. And so we should be, all of us, ready for a surge. What will that be, and what needs to be done? Well, we're continuing to see new variants emerging. They're not talked about so much, but Maria van Kerkhove was telling me that yes, WHO has got a number that are under observation as variants of concern, and they will be continuously examined. The feeling among most people is that a variant that can survive and cause major problems would have to be at least as transmissible as the Omicron variants that are moving around at the moment. And it's unlikely to be more serious in terms of lethality because of the manner of evolution of viruses over time, and that we should expect, therefore, that it will turn out to be more transmissible, that any new variant will probably be capable of evading much of the protection that is available from previous infection or vaccination, but that we're not anticipating at the moment, touch wood, a variant that will cause a lot of sickness and death. We can't be sure, and that's why being on the alert, being vigilant is absolutely key. We continue to ask that as numbers of cases start to rise, that people should do everything possible to avoid being infected. And that does mean, as I've said before, and I will continue to say, continue to have your face mask in your pocket. And if cases are picking up, put your face mask on and wear it properly, really in a very determined way. And then thirdly, we're saying, please do maintain physical distancing and do all this, especially in places with poor ventilation. Now, why are we saying this? We're saying this because even though for the majority of people, COVID infections are not proving to be very severe, the reality is that long COVID is still a major cause of distress. And although we can't be absolutely sure, it seems as though prolonged symptoms after COVID are occurring in around 5% of the infected population. And those prolonged symptoms can be extremely distressing. And as we've heard in previous sessions of these open online briefings, there appears to be more and more pathological basis for these prolonged symptoms, particularly associated with damage to epithelia and endothelia, which is the cells that line various key body cavities or line blood vessels, and that damage can be associated with a loss of function and even more serious consequences. And we've also heard from Dr. Ray Duncan, cardiologist, that she is identifying that when endothelial tissues, the tissues that line blood vessels, get damaged, that we can get microclots forming, and those microclots can lead to damage to heart, to respiratory system, and even damage in the brain. And by the way, I've got a silly old cough that I hope is not due to the COVID that I had some months ago, but you will see me periodically stopping to cough. So the long COVID phenomenon is one that we believe in this group needs constant attention. And since our last meeting 2 weeks ago, Maria van Kerkhove has established contact with Ray Duncan, Claire Rayner, and Claire Taylor, with a view to ensuring that there is a constant conversation between them on long COVID, and it may be that we will introduce others into that group if we can. And that's simply because the WHO, the World Health Organization, wants to try to stay abreast of the long COVID issue and to be sure that we learn from the lived experience of people as much as possible. I think that the only other comment I want to make on the current COVID situation is that the impact of COVID on societies continues to be felt, and felt very strongly. Having just been in North America and been speaking in different settings, in universities, I was at Harvard for a couple of days, or in the UN, or with people that I know in New York, it's quite clear that that city has not recovered from what COVID has done to it, nor has Boston recovered. And I expect that many of you living in cities around the world are finding that life is still quite badly damaged. What we are seeing is that the relationships between groups of people in society, particularly the informal relationships on which people depend for their livelihoods, especially in the informal economy, seem to have been really badly damaged. I think that's partly because relationships in the informal economy are often not written, not codified in any kind of formal sense, yet at the same time, they're absolutely vital for the fabric of society to be maintained. And quite simply, the arrival of COVID, the fracturing of relationships because people could not move, they could not be sure that they will be able to connect with those they normally connect with, meant that there were many letdowns in the exchanges between people. There was a build-up of levels of mistrust, and that in turn meant that life for people in the informal economy, which is so much more dependent on trust than it is in most other aspects of how we live, that just got badly broken. And it will reform, but it will possibly take quite a lot longer than nations that are bounded by currency or credit cards or legal agreements or whatever, and so on. This is my hypothesis, but contacts with people working in markets, people who live on the street, people in the catering sector, people in the hospitality sector, where the informal economies are so important for ensuring that everything keeps going. My informants tell me that things are just not as they used to be. And perhaps that comes through most strongly to me through talking to people in food and agriculture, where, of course, again, there's a great deal of informality, perhaps not always very good informality, around relationships between workers and employers. And a lot of that has also been quite badly dented by the impact of COVID. I think we've seen also that health systems are incredibly stretched, that again, a lot of the informal relationship-based working on which health systems actually thrive has been dented again. Just people have been so stretched, they've lost a lot of capacity to do the extra bit in order to help colleagues out, or do the extra bit in order to support their patients. And many of the health workers that I've spoken to just tell me that they feel densely frustrated, that they just do not have the reserve capacity to give more, and that means that they feel that they're often offering a much less good service to their patients than they would like to. And that really that's leading to a lot of searching questions about what is the purpose and mode of functioning of health systems. To what extent should they be dependent on people's good nature versus on people's performing functions according to certain worksheets and so on. And indeed, Catherine was telling me that her analysis based on her travels recently in North America is saying how important it is to take account of the entire response architecture of health systems and to re-examine what COVID and the impact of COVID on human relationships in the health sector has done for system resilience. I suppose if I had one thing I wanted to plead to governments everywhere is it's this. You put in place a number of key bits of infrastructure on infection control, on contact tracing, and follow-up on good quality isolation of people who are infected, and support for those in isolation, and interconnected systems for sharing data and ensuring agile, adaptable responses. And I'd be saying to them, don't rush to dismantle, please. simply because, first, there will be more surges, and it's just really rather awful if stuff is dismantled when 2 weeks later it turns out to be necessary, and then it has to be reconstructed. But secondly, I'm going to say that don't dismantle until you've checked that we're not going to need aspects of this honeycomb structure of social capital that is so necessary for dealing with infectious diseases and other threats. And when you do start cutting it, what do you cut first? You cut the services that go to poorer people. It's just the way in which cutting occurs. And that's, I mean, there's lots of reasons for it. Partly because poor people, by and large, don't complain so noisily as better off people. And so I'm going to say that if you are going to be cutting back for budgetary reasons or whatever else, please look very carefully at the equity implications of the cut. Because the one thing that I want to encourage everybody to do is to remember how COVID has hit the poorer off people the worst. And that means that the equity dimensions of response is absolutely critical. I think it's really interesting to just keep a bit of a watch on the spread of variants. Catherine's telling me that there's quite a careful analysis of the different sequences that have been stored internationally. You know, there were 106,000 sequences shared with the GISAID database of virus sequences in the month between August the 26th and September the 26th. Most of these were Omicron, 99.9%. But there is increased diversity within the Omicron variant family, and there are a number of BA.5 descendant lineages being followed very carefully. And that's where we will see new variants emerging that may become dominant. And it's just so important that countries are able to maintain their tracking of these sequences and being sure that they know what is going to happen. Sorry. As I look around the world, what I see most countries is a trend of trying very gently and in a rather considered way to reduce the restrictions on people, reducing mandatory COVID isolation for people coming into Australia, shortening the COVID isolation for people coming into China, changing test requirements for people coming in around the world, and so on. Now, there are some major events coming up. And again, Catherine was reminding me that for a number of these events, there will be still COVID testing requirements in place. One of these is the FIFA World Cup in Qatar, where those who attend will be expected to show proof of a negative COVID-19 test, regardless of test status. And I mean, this is coming up, I've forgotten when it is, end of this year, beginning of next year, November to December, that's right.
It's just
I mean, that's quite important that the Qatari authorities who've worked closely with WHO are going to have PCR testing requirements for everybody. So I think I'm going to stop my own remarks at about that point. Perhaps I can't help it but say that one interview that's got quite a lot of prominence in the last few days is Bruce Aylward, our friend who sometimes joins these calls, who has been working on the access to COVID Tools Accelerator set up by WHO and others. And he is basically saying it's time for every country to have a transition plan for how they're going to use COVID vaccines from now on and address the pandemic as it shifts from the public health emergency phase to a more continuous ongoing phase. And I think that it was rather nice to hear Bruce saying this. He said it in quite colourful language, because in my personal experience, an awful lot of countries are moving ahead, but are adopting the let's forget about it and hope that it's gone away approach, rather than what I consider to be the more appropriate approach, which is to have a preparedness strategy for what will be done. And that doesn't need to be complex. It just needs to set out very clearly what kind of signals will be used to determine whether people should put their masks back on, or to determine whether or not some kind of physical distancing should be introduced. I think at the same time, it would be quite sensible for governments to indicate that reimposition of lockdown is a very unlikely response to returns or surges of the virus. Lockdown should never be used as a primary means of control. And I think that the lockdown fear or anger is something that, if it was addressed head on, would make a huge difference to how populations are prepared to focus on it. I think just the thought of a further lockdown makes a lot of people, particularly those who've suffered emotionally during lockdowns, it just makes them feel absolutely horrible. They shudder at the thought of a return. And so my advice to any government right now is be straight with people. It's super unlikely that major lockdowns are going to be reintroduced. There may be some very localized movement restrictions, and they should be super localized based on the epidemiology. There may have to be very localized requests that people wear masks. There may occasionally have to be requests that certain types of social events don't take place. But there should not be a necessity to return to lockdowns. And frankly, there should not be a necessity to shove people in quarantine at border entry points, in my view. Right, those are my comments. Thank you very much indeed, Catherine. And indeed, I'd like to go to you now for any reflections from you, and then any suggestions as to who I might call on first to speak. Catherine.
Certainly. So just a few things. One is a housekeeping piece, is just to remind everybody that this is being recorded and will go onto the Foresty website. Also, I would like to say to Annie, nice coordination of the green tops. You and I look like we are wearing exactly the same color. If there's something that you say that you do not want on the Foresty website in the posting, please do let us know. Twee or I or Tessie or Mahika, I think you probably all have our addresses. Just let us know and we can edit the video accordingly. As far as COVID goes, I find this to be one of the most interesting parts of any massive outbreak or pandemic, where at the very beginning, it's all about the epidemiologists, and at the very end, it's all about the epidemiologists, because in the middle, it's about everybody responding all the time. But at the end, it's about finding the last case and finding the sort of where the virus is living, or figuring out how to live with the virus. And so this transition to where we're at now is fascinating for me to watch. I think David is absolutely right that the one thing that we are doing poorly as a globe is not remembering that it's the poorest and most vulnerable who really are the deeply most affected. And as much as there's a lot of talk time about that, there isn't a lot of doing time. So that's my social justice piece for the moment. But let me instead turn back to David. David, we have a bunch of people who I think would be fantastic to speak with. I don't think we've heard from Ad for a while. Gower, always fantastic. Jean-Luc, we haven't heard from. Megan has both video and audio, it looks like, which is a total win for the week. Yay. So let me throw that out there and send it back to you. And if anybody does want to speak, I see that Iman has put a comment into the chat. She has to leave in 2 minutes. So if you'd like to speak to Iman, let's do that now. And otherwise, let's turn around that we have an incredibly rich group of people here.
Thank you very much indeed. So I'm very keen to hear from all of you, and I am trying to write to you in the chat to see whether or not, because I don't want to ask people to speak who are not ready to speak, but really it would be lovely to hear from Megan if you feel like it, especially as we haven't heard from you for a bit, and partly on COVID, but also how that's played into this cost of living crisis that's going on all over the world, and any thoughts you've got on that. And then after you, I would be very keen to go to Jean-Luc Poncelet, who I haven't heard from for a bit, if that's okay. I'd like to come to David Fedson, if he'd like to talk. Nigel Lloyd, if you're interested as well. And short, sharp observations, gratefully appreciated. And if you don't want to talk, if I come to you, just say pass, and that's absolutely all okay. Peter Hurst, you're looking pensive, so I feel like coming to you as well. No wish to discriminate. And John, when you're ready, don't hesitate to put your hand up and just say, I want to make some observations now. I'm really keen for your view of the learning. Megan, you have the floor.
Thank you, David. How are you, everyone? I haven't spoken for a while. I remember the past 2 weeks, I was rushing to a meeting, but I was listening in the car. So I missed the rest after 6 p.m., but I got a lot. So, however, I just want to explain, share with you what's happening in Botswana right now with regards COVID. We are one of the last countries to get rid of masks because the circular only came yesterday, that there was no need to wear masks. And I was gutted because I was actually happy with wearing masks, and I'm still happy wearing masks. But anyway, people had stopped wearing masks some time ago because they were required to wear them indoors and not outdoors. But you know, it's always the opposite, because when you're indoors, you're basically maybe eating and whatever. So people don't wear indoors and they're wearing them outside. Now we don't wear them anymore. And there's no talk of social distancing. And even at work, we are now being forced to do 3/4 lessons in face-to-face and 1/4 online. So I don't know whether I'm going to be able to do face-to-face without masks. I don't think I'll accept that. So yesterday I had a test with 70 students and I asked them to wear their masks because we're indoors. So it's a catch-22 situation, especially after getting COVID, and I still feel fatigue up to now, and being exposed and being in a room with 160 people and no masks. So I don't know what to do, but I think I'll stick to 3/4 online.
Yeah.
So yeah.
Hey, when was your COVID? When did you have it? When were you positive?
Remember, it was March. Then I went on for 8 years and I was for 8 weeks. I was down for 8 weeks. I had problems breathing and I had problems doing anything.
Yeah.
And my cough lasted a long time, but now I think it's better. But for the past 6 months, I've been struggling really. But now I managed to go up Mount Kali last week, and I wasn't really breathing heavily. But hey, I'm still reluctant to be in groups. And I got that COVID after I traveled to South Africa. I traveled to Zambia 2 months ago. I was okay, but I'm still reluctant to travel, definitely, because it really took a toll on me. Yeah, but then I think that's about COVID. Then cost of living in Botswana, it has never been this high. But then I don't know whether we can attribute this to COVID, because I think it has to do with a hike in fuel prices. Because I used to fill my tank. We have the cheapest fuel apparently in the world. I used to fill my tank with about $70. Now I fill it on 140. So prices have doubled. So everyone is complaining, and there's been no change in salaries. So yeah, people are finding it very difficult to exist, because even grocery, the basics, everything is doubled. So I don't think that's COVID. Maybe it has to do with the war in Russia, because it gets back to the fuel prices. There's been a large hike. Yeah, so I think that's basically what I have to say about Botswana. And I don't have much to say, despite that little.
I mean, we think that the cost of living crisis is due to a number of shocks that have come together. COVID is definitely a shock that has affected supply chains. It's affected people's ability to get employment, and it's had other impacts on the functioning of different parts of society. So we think that's part of the mix. We think climate change has been pretty awful when you look perhaps less at Botswana, but you look at East Africa, the Sahel, Central America, India, and now Pakistan with these terrible floods. There's a lot of climate impact that's coming through, and it's accelerating. That's going far faster than the climate scientists even believed in their worst projections. And then there are conflicts happening everywhere, and they push up prices, always happens. And then we've got particularly the war in Ukraine that's hit energy prices, not all, but some. And then on top of that, we've got speculators who play. And so it's more a big mixture, like in a chemical reaction, lots of different things coming together. And then it plays through to this increased cost of everything, food, fuel, and you add other things, you find other things are going up as well. And suddenly the money in your purse does not cover what it used to. I mean, I don't know whether it's like that for you, Megan, but that's what we're seeing in many places.
Yes, that's what it is really. Yeah, because we are some of the high paid people in the country, but we still find things so expensive.
Yeah.
So yeah.
No, but
I think climate change.
Yeah, go on.
Yeah. And I was saying, I think climate change is also a factor as well, because the pound has fallen so much. And it's like affecting the world, because even Africans are being affected by that.
Yeah.
So yeah.
So Megan, just here's, I mean, others, please do come in on this. You know, if you've had a bad COVID and then you're being asked to take off your mask at work and all that stuff, and you're in contact with lots of people, young people in your case, Megan, I think everybody understands that you will feel reluctance and you will feel naked without your mask, quite simply. And I think that we would all understand if you felt that you had to request that those who are around you continue to wear masks. And whether I'm in US or Europe, I'm hearing that more and more. Back to you.
Yeah, all right. Thank you, David.
But we can keep in contact with it by email. And, last thing I want to do is to cause difficulty for you. Thank you, Magen. I wanted to go now to Jean-Luc Poncelet, and I wrote down in my list after that, David Fedson, and then I put down William, and then Annie and Keith. They've got something perhaps to talk about. We'll see what they say, and I'll keep going like that. I want to shift. I want to be able, if you feel like it, for you to talk about COVID issues, but also do also talk about cost of living issues, because they are very definitely affecting people in different ways. And I am really interested to hear more. And then before the end of the session, I'll just take 5 minutes to talk to you about how we approached the cost of living crisis in the UN General Assembly last week. It was super interesting. And I think some of you will be pleased to hear that. Okay, Jean-Luc, please.
Hi, David and everybody. Thanks for giving the floor. It has been indeed a while that I haven't been, and so my apologies for having disappeared from that so interesting group. But I've been, among other things, working a bit in the Caribbean, so an area that is a bit left out of the discussion. As it happened in the rest of the world, I think nobody mentioned so hardly and so much COVID anymore. But I have had opportunity to visit several hospitals from a completely different point of view, which was disaster reduction and safety for hurricane and earthquake, etc. But an opportunity also to see how much COVID has impacted resilience in the Caribbean. And basically, people continue to die, but silently. As David mentioned, it is not, people do not report so strongly and so vividly as they were doing before. But when you discuss with general practitioner and nurses, etc., they say people are dying of Omicron. Is not report per se. It doesn't make as much noise as before, but they do. So I think that's one comment. The other one is maybe it's a bit out, and my apologies, David and group, if it has been discussed, while I was away. But I think that there's been at the beginning of COVID a very, very strong reaction from the health sector. And the I would call the national sector, the responders were kind of a bit on the side. Little by little they came in, and I think that interaction between the World Health Organization response, or the health sector response, and the national sector has been kind of a bit jeopardized by the importance of the topic. And I was wondering whether, now that we are a bit on the tail of, in terms of aggressivity of the virus and the number of cases, even if we couldn't, it was not a good moment to retake a bit that interaction between the National Disaster Response Agency, the OCHA, the UN response, all those one, and the interaction with the health sector. Basically, the health sector has been proposed as the one who knows everything, and we know with COVID that we know a lot, but the cost of living, the crisis, the financial impact, etc., tourism, locking border, etc. So we have seen that we need the other sector, and I think maybe now that we are a bit less prominent in the response, it may be a good time to rethink about that relationship and how much we need each other to have a more constructive answer in the future. So it's not only to prepare WHO or the health sector for a new response, but how can we better benefit from a financial sector, a tourism sector, construction sector? How can we have, in hospitals, a section that can really deal with a communicable disease that has been disappearing from Europe and from the US or even from the Caribbean? So that interaction for me seems something maybe a good time to retake that one as giving more space to people who are able to discuss But the school have to be locked, yes or no, compared to what we think in the house. Those are two comments, David, I wanted to make. Over to you.
And I personally really appreciate your second comment about the need to appreciate how much this has been more than a health crisis. It's been a crisis affecting all aspects of social organization, all aspects of employment, and all aspects of the economy. And as I look at what has happened globally, there's been an enormous movement of money also from governments to people to try to protect poor people. It's not been complete by any manner of means, but that's also been a huge thing and needs to be understood. So yes, I would agree with you, Jean-Luc. Thank you for that. And thank you also for reminding us what your primary trade is, which is, if I remember right, is trying to help hospitals and health units to be disaster proof. And I'm glad you're still on the road and doing that, despite the fact that I think you've retired. So that's cool. Lovely. That's Jean-Luc Poncelet, with whom I worked in many different places, and lovely to be with you again. And now let's go to David Fedson, please. Any observations and thoughts, building on perhaps, if you like, your very interesting discussion that you triggered 2 weeks ago.
Thank you, David. Can everyone hear me? Good, thank you.
Yes, you're very well heard.
I spoke 2 weeks ago, and I won't, probably much too long, and I won't repeat what I said then. Many of you who are here today also heard my extended comments 2 weeks ago. What I tried to impress upon everyone then and now is that although this is a gigantic public health, medical, social, economic problem, it is fundamentally a medical problem. And all you have to do is talk to any of the doctors or any of the nurses who have taken care of individual COVID patients to find out that it is truly a medical problem, first and foremost, and that the search that investigators ought to be undertaking, which they are not, is to find a way to better treat it, and to treat it in patients who develop serious illness. There have been approximately 25 million deaths worldwide from COVID, and we can't forget these people. We can't write them off. And for all of the scientists who are trying to explain what is going on, for the 25 million people who have died, they don't care about an explanation. They just wanted not to die. They wanted to live, most of them. And that requires an effective treatment. As people recall from 2 weeks ago, I've advocated an approach to treatment that is not caught on, despite the fact that it's more than 10 years old. And it is something that I think all of us ought to be aware of and advocating, actually. It's an approach that probably worked with Ebola in West Africa in 2014, 2015, and it surely should work in COVID. But we have had no interest on the part of scientists or health officials worldwide in an approach to treatment, which could be used in low and middle income countries worldwide. In fact, it could be available to everyone who has access to basic health care. And I wish that all of the people listening in today would familiarize yourselves with this idea, and simply ask the question, why isn't anybody working on this? Why aren't people interested in this idea? Why aren't they testing it? It has been shown to work in observational studies over and over and over and over again. but there are only very few, maybe 2 or 3, very tiny randomized controlled trials, and none that have been advocated by the World Health Organization, the Gates Foundation, or the Wellcome Trust. So I think that all of you need to familiarize yourself with the idea of host response treatment and regard the problem that we still face, both for acute COVID and long COVID, as a medical problem as well as a public health, economic, and social problem. I think this is very, very important, and that something that we simply cannot lose sight of.
So I want you to know, David, that I'm utterly committed and have been to trying to get this picked up. It's probably a sign of my own lack of stickability that I've not yet succeeded. But I think bit by bit, something is happening. And I think the fact that there has been a reach out to Ray Duncan and the Clares from WHO is a good sign. And I am trying my best to not dive onto it and start trying to push it because there does seem to be some difficulty with the approach that you described being picked up by the establishments with which we deal. And it's time for me to have another conversation with you, if you will talk to me about, for me to explain to you my sense of frustration that I haven't been able to get this into the randomized controlled trial space as part of the drug treatments that are being looked at. I have hypotheses, but I don't want to mention them now. So an undertaking from me, others, we will do our, we have had somebody, Karen Palmer said to be reminded again. And I think that we will make certain that we share David Fedson's papers that he shared with us to everybody. Thank you, everybody. Please note that. And now let's go to William. Oh, Willie on this.
Yeah, thank you, David. I don't think I'm disagreeing with David Fedson if I move from medical to actually look at the extensive and comprehensive consequences of COVID, economic, social, institutional, because they are so wide and interconnected, and the effect on systems has been to expose their fragility on an across the board basis, and a fragility which is then highlighted as we've seen this multifactorial crisis impact globally immediately afterwards. And my point is that I think this is actually requiring us to change the model that we use to understand the consequences of events. I think that actually our concept of how events follow each other has to change, and it's not going to reverse. The governor of Florida said yesterday, this is a 1 in 100 and a 500-year event. Well, bullshit. This is now what is going to become common. And for decades, I think my observation here is that for decades, everyone who's alive to climate change has been saying there is now going to have to be dramatic change in the way society operates, in the way business operates, in the way governments operate, in the way consumers behave. In a funny way, we may have come at it slightly sideways, but that is what has happened now. And it's happened as a result of a change in the way events evince consequences.
Thanks, William. And going on now, Annie and Keith, if you wish to talk about your own experiences, if not, say pass.
You're on. I was going to say pass, but we just happened to have contracted COVID in the last 2 or 3 days, having been free of it for 2.5 years. Just seems like a joke, but that's life. So it certainly isn't a 1 in 500 or whatever. It's just going on and on and on. And I think this winter is going to be absolutely horrendous with both COVID and flu. And that's before we worry about the cost of living and all the other problems. Anyway, nice to listen to you. Very interesting. Thank you.
Annie, thank you for telling us. Do you want to say anything else about yourself that helps people to understand why you're feeling a bit miserable?
Right. How do you want me to start?
Yeah.
Well, she grew up with David and William, so that's a good enough reason.
Yeah, I thought.
That's rubbish.
Yeah. Thank you very much. That's Anne, my sister, medical doctor. We're very close in age, and she
Yes.
and Keith have resisted COVID remarkably effectively through being super, super careful. And now the things caught them.
Well, the main reason was we went on holiday in Turkey last week, and
Precautions.
nobody was taking precautions. Nobody was advocating wearing masks on the plane or anything. It was as if COVID had never happened.
Okay, well, I mean, I think on the basis of the contacts I've had with people in the last 2 weeks, that there most definitely is a new wave emerging in Europe. Every Zoom I'm doing, I'm hearing people who got COVID, and it's certainly the people I talk to also around the place here in Switzerland are telling me that they want to get their masks out again. So I think that whoever you are, wherever you are, especially if you're in our kind of age group, Annie 71, me 73, we ought to be being just cautious. No.
Thank you.
Now, I want to just spend a couple of minutes on the global crisis. I mean, what's happened in the most bizarre and rather scary way is that from about the middle of last year, we were starting to see all over the world that prices of key commodities were really picking up and rising quite rapidly. It was associated with a lot of supply chain disruptions, which were directly attributable to COVID, but it was also associated with the acceleration of climate change, what Megan was just describing, and with really very serious shortages of water for farming, but also for life, followed sometimes by intense floods that were awfully messy and washed everything away. And that was coupled with just numerous locations where violence was being used to resolve conflict, and that was in turn paralyzing the functioning of societies. And this increasing cost of living is felt by everybody, but is most biting and difficult for people who perhaps spend half of their income on food, and they will be the ones who are most severely affected. We call them, obviously, people who are close to the poverty line, and they are largest in number actually in the middle-income countries of our world, because most of the people live in middle-income countries, though they are highest proportionally in low-income countries. But there are poor people also present in high-income countries. A meeting that took place yesterday, President Biden described, and we heard him, how 1 in 20 Americans are basically caught in the poverty trap and are experiencing firsthand the cost of living crisis. This was discussed at the UN General Assembly, and I'm going to give you 3 findings. Number 1, cost of food, cost of energy, cost of life, purchasing power in your pocket, they're all related, and they are very much affected by whether or not the government has got money to help people out. So governments of countries that have got very limited cash with which to meet people's cost of living needs are the ones facing the greatest difficulty. There are 40 countries that are in real difficulty and are likely to default on their debt in the coming few months. This situation is desperate. So point number 2, the only way to deal with it is to make more money available to the governments of poor countries and to find ways to restructure debt servicing payments of poor countries where possible, forgiving them. But unfortunately, there is remarkably little willingness of the world's rich countries to do a massive release of cash, what's sometimes called special drawing rights. Number 3, this is not a crisis that's going to stop tomorrow or next week or next month or next year. What came out in New York was this is the new reality that we're all living in. It's a new reality for poor people everywhere, for poor countries everywhere. And it's because of climate change, as William said. And it's going to go on and on and on. It may not be as bad as 2022 every year, but it's not going to suddenly get easier. And yet we have world leaders who find it super hard to sit in the same room together, let alone talk to each other, which is not a good environment to be dealing with this. And so final point, of course, the presidents and prime ministers of poorer nations are going to try to show solidarity and try to get change. But if the world's wealthy nations are focused primarily on their own electorates, which of course they are bound to be, it's super difficult to imagine a collective rescue package for the poor nations unless public opinion really starts to come out very strongly. So the world's charities are getting together at the moment and are working out how they can possibly build a global campaign around trying to help poor countries and poor people cope with the cost of living crisis, but in a way that gives them resilience so they can better deal with future emergencies when they come and not be dependent on what some people call handouts. That was a mood. It was a very depressing UN General Assembly. I'd like to move to John now for any comments that he might want to have. And then I know one or two others might want to talk, but we're quite close to the end. John, please. And Peter Hurst, after you.
Yes, David, 3 things that struck me that have come out of what you've been saying. The first was this sense of informal relationships and the informal economy being damaged by the impact of COVID. I would say I've seen that in large commercial organizations in the last few months as well. They are not functioning as well as they did because that glue that binds us all together has come unstuck to an extent, and it doesn't stick back together quickly. So that was the first thing. It's not just the informal economy for me. Second thing is about learning. On the face of it, how we learn is pretty straightforward. We look back and agree what happened. We take out of that what went well and perhaps what didn't go so well. We draw some conclusions from that and then we implement them. But the nature of what we've been through and the focus, as you were saying, from particularly wealthy politicians on their electorates, is that what happened is contested and incomplete. What went well and didn't go so well is therefore seen as a matter of perspective rather than as a matter of fact. Conclusions, therefore, are drawn in a political frame, and their mechanism for adopting whatever comes out of it and actually making something different is increasingly strained. So learning from this is not just about what have we learned, but how will we get to do the things that we've learned. And if we can only do a bit of them, then we need to make sure that we really, really do. And then the last thing, David, for me, and it's something we've been on a few times through this, is at the moment there seems to be a real absence of story. What is happening? What do we need to do? Where's this going and where is this heading? Politically, it feels like we just want to forget it ever took place because most people struggled at some point with it politically in dealing with it. And most people don't want to have that pointed out. So it's almost as if we're trying to pretend it never took place and now we're in another place in the world. And without a story that says, as you've been saying, it's still here, we're still going to get some surges. The responses to it are remarkably simple. If we focus on the right things, we can make a difference to treatment and other factors. But it needs a story that tells us that, and we need to keep saying that. Thanks.
Thank you, John. Everybody, do keep coming back every 2 weeks. We may occasionally have to shift because things are a bit uncertain in the next period, but we are going to go on shifting to much more of a learning posture through these sessions. And it's great to see that the chat is alive and active. I just go for some quick reactions to what John has said and anything else, sort of 1 minute quick spurts if you can, only because I don't want to go on much longer than our time. Peter Hurst, please. Welcome and thank you for joining. It's lovely to see you again. Over to you, sir.
Thanks. Okay. As ever, my remarks are about the worker side, because and especially about the food and agricultural workers, because they're part of the world's core poor. The people you're talking about are the essential workers who've been sent onto the farms and food processing factories. If you look at what the unions are doing at the minute, they're concerned with about the safe return to work during COVID-19. And you'll find sort of they're saying, keep the social distancing, keep the use of PPE, etc., etc. But what they've not picked up on is the long-term effects of COVID. Now, I'm quite happy to put together some simple information for the unions, but I would need help to do it. I'm not sufficiently qualified in terms of the terms and the language, but this would be very valuable information to get out. The stuff on cardiovascular was fascinating. And the other side of this, as a longer term thing, we're going to have to think about the COVID response, how it fits into company health and safety policies and company employment policies. Things like sick pay, we're just going to have to think this through, because in terms of, you mentioned the word preparedness, that's how we're going to have to have preparedness at the industrial level. Thanks.
Peter, are you still in Switzerland or have you gone somewhere else?
The answer is I am.
I think we should meet, and we should also build around the relationship that we have with the IUF team, James,
and the ILO.
And the ILO. That would be really lovely. And I mean, I will try. I will connect with you. Back to you, Peter.
I've sent you my email, so if you connect me, give me some dates, I'll meet with you. Okay.
Thanks a lot. Absolutely brilliant. Let's go. Did anybody else have their hand up? I've not been looking at my screen properly. Okay. Kat, back to you for last word, and then we'll close.
Just to mention Rebecca's recent post in the chat, which is that we all, and I know David has been thinking and focusing on mental health and the impacts of climate change, but also COVID on health and mental health in particular. And I think the Twitter feed that Rebecca just posted is a really important one, that people, or is that, sorry, this is different than this is the wastewater mRNA in the Boston area. Sorry, I will send the one that Rebecca sent me, which is about a reporter who has spent the last 2.5 years focusing on COVID only, writing about COVID, himself having COVID, the whole experience of COVID, and that he is exhausted and taking time off from his work and his life. And Rebecca, if you have a chance to stick that, yeah, you're gonna put it in the chat. Thank you. I mention it just because we have been so consistent in having these conversations, and you all have been so consistent in being here. But I want to just say, everybody, please remember to take care of yourself. It is a big deal, and it's hard on everybody's mental health and their space and how they behave in the world. And so I hope you are all taking care of yourself. And I appreciate the fact that I was able to be gone for a couple of weeks to go and focus on my own, not my mental health necessarily, but just being away from work. It was a blessing. So I appreciate everybody here. Thanks so much. Have a great Friday afternoon. David, I don't know if you want to do a kind of last rounds of goodbyes.
Thank you very much indeed. Just to say that in my exchanges with Marianne, who's just come back from Uganda, I am reminded of something that probably we need as the final word. Marianne, could you just say it, and say it as you feel it?
Well, I wasn't going to say anything, David, but if you insist.
Sorry.
I think that the whole thing is when we may not have the right approach. The Secretary General is looking at part of it, but this is something that is interlinked. And just going back to the 2030 agenda, it talks about interlinkages, and you can't just take one approach to what's happening now. It's got to be a multi-sectorial approach, and maybe this is something we can talk about at some point. Thank you.
Thanks very much indeed. That we will definitely do. I mean, it's super tricky for him. He stuck his neck out to even set up this group that he's got. And it's not been easy. And what I'm learning from working very closely with them is that they have to constantly be feeling, where is the political space within which we can operate? And I know he would like to take a much more fundamental, people-centered view. He would like to challenge governance in a lot of settings and so on. But he's sort of, he's operating in a very restricted space. But let's talk about it. I think the great thing about this group is that we can function in a way, in a manner of safety and mutual respect, and that means we can talk about stuff that's got a bit delicate edge to it. So we will do that. Thank you, everybody. I just want to say, so grateful to you all for being here. We will try to meet again in 2 weeks' time. We'll send you around the details, and in the meantime, I support Catherine and what she's saying. Everybody, look after yourselves, and if you get stuck on anything, be in contact with us. Don't hesitate. We love to stay connected. Bye bye, everybody.